Hi, are you perhaps wondering how much weight loss surgery cost? In this video, we will try to answer your question. In reality, medical costs for morbidly obese patients are just as much as their weight, if not so much more. Increasing research show that bariatric surgery is very effective in curbing excessive weight gain, reversing, and forestalling of dangerous obesity health outcome. But the enormous costs of this surgical procedure has greatly limited its extensive use. With the increase of morbidly obese age groups, plus growth in their levels of obesity, their conditions may thwart progress previously made in chasing down cardiovascular diseases. In addition to the widespread treatment of obesity-linked risk factors, like cancer deaths, could be curtailed with more advanced treatment and preventive measures. The most prevalent cancers amongst morbidly overweight people include esophagus cancer, gallbladder cancer, ovaries cancer, kidney cancer, colon cancer, breast cancer, and pancreas cancer. We all can agree that treatment for these are not exactly cheap. If there continues to be an increase in global obesity trends, substantial increase in death rates should be expected. This is as a result of all the terrible health challenges linked to being obese. This will be accompanied also with raised health care costs. What will my weight loss surgical procedure cost? Well, weight loss surgical procedure is quite expensive. There is no sugar-coating this fact. But the cost of any weight loss procedure is greatly dependent on some factors. Here are a few. 1. The surgeon's fee. Definitely, this will differ as per the surgeon's expertise and proficiency. The complexity of your intended procedure as well as where you reside will also matter. 2. Hospital of your choice. The cost will be different depending on the hospital you decide to use. Costs include operating fees, hospital rooms fee and other miscellaneous charges like device fees. Surgical associates fee, anesthesiologist's fee, checkup procedures fee if you had gastric banding, and consultancy fees. 3. The type of procedure you are going for. As you know, there are various kinds of weight control surgical procedures. They include vertical gastric banding, stomach binding, biliopancreatic division, intragastric balloons, electric implants, etc. All these have different cost implications. Note this: if you are opportune to have medical insurance, review your policy cautiously. Work meticulously with your insurance officer and your surgeon to find out what is covered. Many insurance companies agree that morbidly obese people are prone to major health problems like heart diseases, high cholesterol, sleep apnea, etc. You may have to foot your entire bill if you 1. Do not have medical insurance. 2. Do not have insurance via some large employer, say 50 to 60 people. 3. Reside in a country or state that did not include any weight loss surgical procedure as part of its essential medical benefits. Most weight loss help centers assist people looking for a means to undergo weight loss treatments, acquire a loan which can be serviced over a duration of years. Morbidly obese, so what? Well, for starters, you could be in a life-threatening situation without even knowing it. More so, being morbidly obese is robbing and altering your life expectancy rate and killing you slowly. Obese or morbidly obese people deprive themselves of at the minimum 7 years of probable lifespan. Also, there is an increase in the years lost. It increases as per the gradation of obesity, reaching almost 15 years for the obese with BMI of 55 and more. The decrease in a morbidly obese person's life expectancy could be graded extreme and is most similar to that of adult smokers. The difference is that as you get more obese or morbidly obese, your life expectancy falls a lot lower than the life expectancy of smokers. In contrast to their healthy weight-ranged peers, morbidly obese people are most disposed to suffer premature heart diseases, diabetes, cancer and so on. For men that fall under the grade 3 obesity, heightened mortality rate associated to diabetes and heart issues is elevated in contrast to healthy weight range males. For morbidly obese females, cancer-related deaths are very eminent, as compared to the healthy weight range females. Recent research explain that excessive weight may be much more deadly for men in contrast to women and younger adults. This proves that weight loss supplements and medicine alongside lifestyle counseling function moderately in assisting the overweight persons lose and keep off weight. Predominantly, mortality or death linkable to every cause swinging from lingering respiratory infections to injuries was a lot higher in morbidly overweight people. What is the right approach for losing unwanted weight? The realization of the existence of various kinds of obesity must give rise to diverse methods of curbing and treating excessive weight gain. If you are obese or morbidly obese, you may have tried out few or a lot of the methods for losing weight. The recommendation may have come from a doctor or friends because it worked for people they know or themselves even. Maybe you find that none of these worked for you despite you giving them your best. Do not feel shamed or get discouraged because it seems like you have not had any success with losing weight. Rather take solace in the fact that it has been established that there are variations of obesity out there. It may not be your fault that none has worked for you yet. What works for the rest may not definitely work the same way for you. Regardless of all that, what makes the difference is that you never give up. Keep trying till you find what works for you. Because a huge number of obese people can and actually do shed weight often once they find the approach most suitable for them. These weight loss methods often come in varieties swinging from medications and supplements, to dietary and exercising approach, down to surgical procedures. Bottom line is every weight loss procedure or option begins and ends in a healthy lifestyle. This includes dieting and exercising, so never exclude these. Judiciously abiding by all the simple precepts of healthful eating will make your weight loss journey easy. It will reduce drastically your chances of coming down with obesity-associated diseases like diabetes, cancers, heart diseases and others. In addition to inculcating a healthy eating habit, physical activities are just as important. Put your mind and body to a better condition, safe keeping yourself from chronic illnesses which will be beneficial to you in the course of time. Never compromise a good night's sleep, as this is a chief factor unlocking most health protective benefits. Sleeping better will help in stress management, losing excess body fat, curbing obesity, and better heart health. It is worthy of note that going under the knife is just a tool that is intended to help with morbid obesity. However, this should never be your first port of call when looking to lose weight. Weight loss surgical procedures can be risky and life-threatening when they are not done right. It could lead to so many other health complications. We advise that you try all the other less risky weight control options on the table very judiciously before giving surgery any thought. Whether you have had surgery or not, it is still pertinent to have a healthful lifestyle. Inculcate a religious exercise schedule and diet discipline. This will keep your body in check and burn off any unwanted body fat that has stored up in your body. Be consistent and never give up. If you've enjoyed this video, click the subscribe button below and hit the notification bell so you'll know once we post a new video. Also drop a comment below so we can know your thoughts. Finally, don't forget to check the description below for more details and visit our site www.zimweightloss.com for more awesome weight loss content like this.